Oh, baloney. The whole thing always gets back to drugs.
This is what I learned throughout the years, and in terms of looking at PCOS from the lens of TCM, most of the work I did in back in the original days was with Randine Lewis. So if anyone of you here also trained with her, you'll find this familiar. I've added a few things from Jane as well, but very, very quickly, the channels, the mostly involved Chong and Ren Mai, Dai Mai as well a little bit. That tends to be because of all that fluid in the lower jiao. Organs, kidney, spleen, liver tend to be really involved as well, especially when it comes to the fertility side of it. And pathogenic factors, yeah, we all know about phlegm and damp, and then blood and qi stagnation. And if you look at these, you can actually just, if you take this and think about the points that are most commonly used in clinic, those make more sense than the ones that are being used in research, because it tends to be that in research they're using a lot of points in the belly area with electroacupuncture. That's to get the ovulation out and done as quickly as possible, because you're going towards getting pregnant, because that's normally what these studies are looking for. So for us in the clinic, we can actually see that we're doing a lot more of this and overall, rather than just focusing on the that aspect of the fertility side of it. The apples and pears, this is something that Jane always says in her talks about comparing apples and pears when you're talking about PCOS. Again, you know, that spleen chew and the dampness side of it compared to the liver qi stagnation, spleen and tonifying qi. I don't spend as much time in clinic, hands up, as you do, but I would be really interested that while I was still in clinic, I was seeing a lot more of these liver qi stagnation than the other ones. You still see some of that, the spleen type and the damp type, but I was seeing a lot more of this liver qi stagnation. So it'd be interesting to find out from you if this is still the case in the clinic. But as I said, in terms of individual diagnosis, like you can have all of this. This is stuff that I use to guide me. This is like, I was saying to Siobhan the other day, this is like the talk that I would like to have had put together when I started, but you know, it takes time to get all this stuff together. Always look at the importance of fat and where it is in the body. So if it is very, very close to the uterus and the ovaries area, and how you then affect that and impact that. Again, hormones, I'm going through these because you know this stuff, and I'm giving you these slides as well. Excess androgen, this is a big deal. I had a call yesterday from one of the colleagues on that hospital group that was asking about one of these like typical excess androgen patients, and she was like, she works in the IVF clinic, and she was like, I don't know what else to do with this patient, can you help me out? And it was one of these excess androgens type patient. Things like hirsutism and acne, you see this being a big, huge impact, especially if it's younger patients coming into the clinic, because it's affecting the way they look and how they feel about themselves as well. So pay really, really important attention to that. And then use what you can, use what you got to explain it to them. So one that I used to use a lot about this discussion about is, are androgens more important, is insulin more important, what PCOS, dampness, no dampness, just it's all connected. You can't just take one out of it, and we know that from our Chinese medicine background that it all matters. And recently Dr. Fiona McCullough put this together, and it was really interesting because the background of this was, if you take that high insulin levels part of it out of the equation, she said, it took me longer to find out where to put the high insulin levels than to do the other one. The other one was easy enough for me. I can visualize the impact, and I can give a little bit of my Chinese medicine background. She's also a naturopath, a naturopathic doctor. She said the other bits were easy. It was like, where do I put the insulin levels though? And it kind of ended up outside of the factors, but really, really impacting on, again, going back to the kidneys and being a really impact to those patients who are trying to get pregnant. So insulin resistance, again, really, really important. Use what you got to explain why you should be treating insulin resistance in the clinic. And we know that there's enough evidence in terms of acupuncture of how and what we can do to deal with insulin resistance. We know from the low frequency electroacupuncture that it can affect endocrine, it can affect neuroendocrine, and also metabolic disturbances, obesity, diabetes, hypertension, and PCOS. This paper is from 2009. I tend not to use animal studies. I'm not saying I agree or disagree. I tend not to, unless it's to talk about mechanisms. This particular paper talks about acupuncture for insulin resistance. This includes animal studies and human studies as well. Insulin resistance, one of the, again, hands up, I thought this for a long time, is a big issue for the overweight patient. No, 75% of lean PCOS also have insulin resistance. It's an issue because in the adipose tissue then leads to inflammation. We need to treat that. And again, why it is important since 2012, we already know this. The PCOS is kind of like on that middle line, and then there's the gestational diabetes, there's diabetes, cardiovascular issues. PCOS doesn't go away with pregnancy, doesn't go away with menopause. It happens. If you saw from last month, it was the Heart for PCOS month. Cardiovascular disease, the NIH is giving a big, huge attention to that as well. Inflammaging, this is a term that you hear about this in the US all the time. We know about this, so we can position ourselves here and offer our expertise of why we talk about inflammation, how we deal with diet and lifestyle in our clinic, and using research that we can inform our patients as well. For overweight patients, you do have the 5% reduction can make a difference. So all small changes matter. So don't let people think whatever they want to think about acupuncture for weight loss. Explain to them what it is. And again, be creative. I wasn't even aware of this at all until I can't even remember how it came up, because I normally don't search for anything other than acupuncture because of the work that I do. Moxibustion. There's moxibustion for losing weight, and they show you where, how they were doing it. And again, be creative. Tell us what you're doing in the clinic, and it might be the solution. Even if the studies are small, when you put them all together, like in this one, you put 36 of those relatively small, and you end up with almost 350,000 patients, right? And you see that it's not just sometimes the conditions, it's not just the eating disorder, it's actually looking at sleeping disorders and how that affects these people with PCOS, lower sexual satisfaction. So if these people are trying to get pregnant and they're coming in because of infertility and they're trying naturally, lower sexual satisfaction, how is this going to impact, right? So you can position yourself there in terms of how you can get on that frame to be able to help these patients. And again, you've seen these slides again, you can have them. These are just the points. Every once in a while I change a little bit. If there's anything major that I would add, have this, I keep it with me, and it's just kind of like a good way of refreshing that particular one for this or for that. When you're in clinic, again, I'm giving you all of this. You can have this. If there are points there that you say, oh, actually, I don't use that in the clinic anymore, I use this one instead, report that and tell that to people who are designing trials so that can be included in the trial as well. Dong acupuncture, I, again, think outside the box. I didn't know much about this, but here you are. You can actually go 60 people in this trial, relatively small, yeah. But you can see that they tell you, again, it's the recipe book. They tell you exactly what they were doing, how they were doing. They were actually using a moxa box as well. This is the recipe. You can read the paper, and now you have your recipe to be able to use it in the clinic as well. So for you, and it's really wrapping it up all together because we're right on time. Here's why it matters and why you matter. The support from both educational institution and professional bodies. Here we are. And again, thanks to the FPI for doing this, because you're following this is from 2021. There is a need. This is reported already in research coming from a university, either during the undergraduate or postgraduate education program, to be teaching these things. And this is what I've been doing with EBA. I've done it in Canada, US, obviously Australia. I'm doing it at the end of this month in Switzerland, in Austria, in Portugal. Actually, the college that teaches the medical acupuncture, by the way, medical acupuncture, want DBA to go in and talk about these things. So you need to position yourselves. We need to position ourselves, and I include myself in it too. I'm not spending as much time in clinic anymore, so please, you do it. And it's just to make you all feel confident when to implement research into their practice, right? And this includes ensuring that you, as a clinician, are also involved in the research design. And you'll see that from the previous slides, where who is the practitioner doing the trial itself? Who is that person? What's their training? What's the rationale for how they're doing that acupuncture?